Hi, I'm Erica Del Sordo. I have a very special show today. I have Dr. Alejandro Badia and Cindy Papale. Now, Dr. Badia is the founder and chief medical officer of Ortho Now Orthopedic Urgent Care, and Cindy Papale is a breast cancer survivor and three-time author of The Empty Cup Runneth Over. And we have Experts in Pink, Your Guide to Breast Health. And then there's Miami Breast Cancer Experts, your indispensable guide to breast health. And she's also another one of my beautiful cousins. Hi, Cindy. Hi, Dr. Badia.
Hi.
How are you?
So, Dr. Badia, I do want to start off with you. And because I was reading the Market Insider interview that recently was done, like March 18th, I think is when they put it out, which is pretty impressive. If anyone would like to read that, I'll put up a link. In there, you said, since emergency staff needs to tend to COVID-19 patients, if you have any kind of bone or joint injury, musculoskeletal, to instead contact a single specialty orthopedic center. Can you explain to folks what that means, how come they shouldn't go to the ER, etc.?
Sure. Well, the COVID-19 pandemic has simply amplified the need for this type of center. Even before this pandemic, it's very typical that in my office, which is called Badia Hand to Shoulder Center, I'm a hand surgeon. I do hand, elbow, shoulder work, but almost virtually every patient who came to me has been somewhere or several places before seeing me. And think about the incredible inefficiency, not to mention the cost of that. But now we have the added problem that it is a danger, particularly with the older patients. So most of the wrist fractures, for example, that I treat, those are generally in elderly. So if the elderly person goes with a broken wrist, they're being exposed to the virus.
Yes.
And we know already the mortality rate there is much higher, much higher.
Mm-hmm.
So the idea is you should try to avoid the hospital when this happens. And nowadays, everybody's now connecting like we are, right? Virtually. And you can find the right doctor. Now, currently, Ortho Now unfortunately just closed its doors temporarily. But we think that people should seek out something like that when they have an orthopedic problem. It's always been the case, but now it's simply amplified.
Okay. And we were discussing prior to us starting this about doraldoc.com.
Yeah.
That is where folks can find a doctor in their area, correct?
Yes, and find an orthopedist in the right subspecialty. So the other message is, if you have a broken wrist, you don't want to see my colleague who does spine work, right? And certainly you don't want to come to me for a foot and ankle problem, even though people think the foot's like the hand, right? Yeah, that's a common misconception. So, so Doral Doc, and Doc stands for, well, not only Doc, right? But what's up, Doc? But also it stands for Doral Orthopedic Clinic. It's a self-contained one building, easy parking, no tickets, no parking garage. You just park for free and you walk in. And in that building is several subspecialists, including myself, in the lobby. And across the hall from me is a surgery center at Doral, which is currently closed, but I suspect we may open next week because we're getting such a backlog. I mean, I'm doing telemedicine consults all the time. So, so through doraldoc.com, you can find, and we have therapy as well, so that's listed. So a lot of patients, we're doing tele-rehab, so virtual rehabilitation, but some of the patients do need to come in. So all of that you can find on the Doral Doc website.
Okay, and like I said, I'll make sure I put up that link when we go ahead and post this video.
Sure.
Cindy, you were explaining that there is a center that's still open.
Yes, actually, my boss, Dr. Roger Corey, has a Miami Hand Center, and they're open, of course, for emergency cases. As we mentioned, it's best really not to go to the emergency room as they are overwhelmed with coronavirus patients. So that is available. And, I just want to make everybody aware that this is a time that we all need to come together, and it's happening. I see it on the news. I see it in social medias, on Facebook and Twitter. But it's a scary time, including for myself. I don't even know if I have a job in 3 weeks to go back to, but I do have faith that this is all going to come together and it's going to be clear that everybody will be okay. It's just,
Most of us.
you know, hopefully most of us,
Yeah,
correct.
unfortunately, you know, some of the,
I myself am scared because I need medical insurance, and that's another issue. If I don't have
Yeah.
insurance, I can't get my medication. I have blood pressure medicine that I take. I stay close in touch with my cardiologist, who I drive crazy because I'm always getting palpitations, and this isn't helping. This
yes,
pandemic.
if you have I should say, if you have a comorbidity like significant hypertension or a past history of having, you know, when you have any type of malignancy, you're going to be immunocompromised, right? Because of the medication. So you're not sure what's doing that long term, what that's done to your immune system. So people like that, people like Cindy and many other people should take particular caution in the social distancing, in trying to get groceries delivered, and definitely if something acute where you cannot wait and you need medical care, you definitely should avoid the hospitals. But I also want to say, unfortunately, people equate, for example, when Ortho Now was open, they equated that with, say, MD Now or one of the other urgent cares. Those are terrific places when you have, you know, a sore throat or you need but now those places also have people with symptoms concerned who also are smartly do not want to go to the hospital, but that is not the place to go for your wrist fracture. That's the reality. So I know it's a difficult time, but the consumer now has to kind of explore a bit more.
Okay, I think that's great to let people know. Absolutely, because no one knows that, and that's very true. Why would you go if you have a wrist fracture? Why would you go to the hospital? And then now you've got coronavirus on top of your broken wrist.
No, and the problem is there's so many of these urgent cares, and they do they fill a great role in society because for lesser problems, you also don't want to crowd the hospitals, and now that's important. So general urgent cares now should be used. I'm simply saying not for orthopedic problems. Just like if you have an eye problem, you really want to seek out an eye professional. You don't want to go to a general urgent care. You certainly don't want to come to somebody like myself. So it's important that people now are like, you know what, I have a severe knee pain. I can barely walk. Okay, let me find the right person. Okay, it's not chest pain. You have chest pain, yes, you have to go to the hospital. You wear a mask and you go to the hospital. Not, yeah. So it's important to now be a very smart consumer of healthcare.
That's true. That's very true. There's flhealth.com. I know the Florida Health site is where everyone can find out still where they can get tested. I'll have that phone number in just a moment. Cindy, did you want to add anything in regards to who you've worked for and what exactly is happening on that aspect or that side of the medical industry?
Thank you, Erica, for asking. I worked for Dr. Roger Corey with his Miami Breast Center. He also has the Miami Hand Center. And right now, as you know, elective surgeries are forbidden. They're canceled. No one can have an elective surgery unless it's an emergency. So right now, we do a lot of elective surgery. So unfortunately, we had to cancel our patients. Many of them are, to them, it's necessary, but to us, it's elective. The Miami Hand Center, as I mentioned, is in Coral Gables, Dr. Roger Corey's center, and he is open. The Miami Breast Center, however, is not. Like most other physicians that are plastic surgeons in private practice, their offices are closed because they're elective surgery cases. Now that, of course, puts a lot of stress, the word stress, on everyone. And stress releases in your body a chemical that can really, and for myself, because I have autoimmune also. So I have a lot of medical conditions that I get more scared about not having insurance because I am being treated. But back to, the help that's out there. There's a lot of help out there. There are many places to go, especially that are outpatient facilities or their urgent care centers instead of going to the emergency room as we talked about.
By the way, the elective surgery hold, I think is going to be lifted soon because there's such a backlog. Because there's many things that are being considered elective. I'm on a website with my colleagues from the American Society for Surgery of the Hand. So we're probably about on the listserv alone is about 700 people out of the 2,500 members. And in those 700, I can tell you that this is a challenge for all of us around the country, actually, and around the world even, because there are international colleagues who are members. And I think that the surgery center moratorium is going to be lifted, because there's a lot of things that fall in the middle, including that wrist fracture. Believe it or not, the wrist fractures are often not treated like an emergency. So you break your femur or you break your hip, yes, then you have no choice. You really have to be in a hospital. You're not ambulatory, and that can't wait. A wrist fracture will sit around now in a splint for 2 or 3 weeks before being fixed. So I have a backlog myself. I want to full disclosure. I want to report also that I'm now seronegative. I tested. I got the result yesterday. Shout out to Broward Health. Broward Health stepped up before anybody in South Florida, and I was tested in a drive-through. And the reason was I had been in Australia last week lecturing about wrist problems at a big Asian Pacific meeting, and not only did my staff want to let me in the office, but my kids did. My ex-wife didn't want my kids to see me. So yeah,
that's
so
understandable.
I was going to say, I can't blame them.
Yeah. I was skiing in Italy. I spoke at a meeting in Switzerland, and I skied with my colleague, and he's in the epicenter in Bergamo, Italy. And so I'm in touch with him, and it's pretty scary. But you know, from the beginning, I practiced a lot of basic principles that people can do. You have to frequently wash your hands. You have to be careful what you're touching. If you have to touch something, use gloves. You know, the mask use is a little bit, you know, I think it's more for people who are healthcare workers. So when I see patients, I'll be wearing my mask. But more importantly, if you're positive, even if you're not symptomatic, or you think you might have been exposed, then you should wear a mask.
Yeah, absolutely, absolutely.
I also want to mention that you know, it's so important to stay home. You know, in the beginning we had the spring breakers out on the beach, and this might not be true, but I heard yesterday that the New York Transit's still running, or people are still out home.
But the transit's running, I know, because I trained in New York. I spent a decade in Manhattan. If I could get to New York, I might have gone there to spend a few days, and you know, I can't even get there. So in New York, the problem, when I was reading about this, you know, I trained at Bellevue Hospital. It's one of 22 public healthcare facilities in the city of New York, and all of those healthcare providers, so the clinicians, the nurses, the techs, they all need to get to work. So what New York and other big cities,
we all need to get to work.
True. But I'm just saying right now, in terms of the people who are trying to save lives, that's why they have to leave it open. But you're right, is that you have to screen yourself. You basically have to stay, you know, I'm going to stay away from public transportation, because you can contract it or you can transmit it.
Correct. You know, it scares me. It really scares me. I've been home now for 6 days, and I've been trying to figure out things to do. But you know, the saving grace is social media. Things like what we're doing.
It is.
I have watched on social media and even on the news some of the things that these people are doing. What touched my heart was a young girl in New York. It was her, I'm not sure if it was her fiance or her boyfriend. It was his birthday. She went around to the whole apartment complex, notes under the door, to sing happy birthday at a specific time. Well, they did it. She recorded it from the window. He came to the window and they all sang happy birthday. I was crying. I'm a sap. What can I say? It was the most heartwarming video that I've seen.
Erica could perhaps share that link. We can all use something uplifting. But at the same time, social media, let's understand, it's very important for education. And one of the things I wrote about in a recent article that I think is good, that just came out, I basically said that with social media, you got to make sure that you follow the experts' advice, because there's a lot of nonsense out there. Of course, people love to seize the doom and gloom. So at the same time, the fear works against us.
Oh God! Yes.
You know, I listen. Every other day, I'm listening to what Tony Fauci says. Tony Fauci was a person I listened to when I was a resident at Bellevue, and AIDS came out. We were ground zero. Us in San Francisco were the two hospitals. So I was doing surgery with my arms up to the elbows in blood in AIDS patients.
Oh, wow.
But I was educated about what to do to protect myself. And, of course, if you were misinformed or you were reading, back then, there wasn't even the internet. I hate to say that, but I mean, really, forget social media. So now with social media, you have great, like Cindy just said, you can have uplifting stories, you can have education, but you can also have, I hate cliche fake news, but you have people out there putting out things that are not true. And that is not helping us. That's not helping us at all.
That's not helping at all, and that's aiding the pandemonium, which we've really had. I do want to quickly, I have to correct something. I said flhealth.gov earlier.com. The correct website for folks to go to is floridahealth.gov. floridahealth.gov, and then that call center number is 866-779-6121. A couple things real quick. I wanted to also mention when we were discussing the young folks who are out on the beaches and it's their spring break and they don't want to go home. Just to add on to that, what they don't understand is, no, you may not get sick, you can't live under a rock. That's all understood. And the problem is what's going to happen is they're going to go home to 90-year-old grandma and they're going to give it to 90-year-old grandma.
Exactly. Thank you for saying that.
Yes,
that's the problem, is that we are all vectors.
You're not understanding, and that's what's so upsetting to us watching that. You're like, no, you don't get it. You could carry that to the elderly who can't handle this illness.
Or someone that has a low immune system. It could even be their friend they're playing volleyball with on the beach.
Correct, absolutely. I do want to mention we're going to run out of time here in about 6 minutes. So I wanted to mention, I don't know if Dr. Badia, you want to add anything where folks can find you, and then Cindy, if you want to add any last requests or anything.
I do. I have some resources.
Okay.
Yeah, I mean, for myself, I've always had my website, which has been around for 20 years. It's just drbadia.com, which is DRBADIA.com. Badia like the spices, although no relation.
I like it.
Yeah. I once met Pepe Badia, and he goes, sometimes people ask me if I'm related to the surgeon. I go, wow, okay.
That's cool.
So drbadia.com, but even though at this time, and I do oftentimes take walk-in patients as well. I hate to always disclose that, but because really that was the role of ortho now. But at this point, you can find me, and you can find all the other specialists that you might need at doraldoc.com. So I think that's the most important site, really.
Okay,
good, excellent. Thank you, and thank you very much, Cindy.
Yes. Okay. As a breast cancer survivor, I know that there's a lot of breast cancer survivors and thrivers and previvors out there. Some going through treatment right now with chemotherapy. So you need to be, of course, obviously very careful. We do have some support groups that I'd like to announce. We have a dear friend of mine, Positively Pat, who's on Facebook. And we have a Link of Hope sister group there, and there are women from all over the world that are going through treatments or finished treatments and still keep in touch. But Positively Pat on Facebook, you can get through to her to join Link of Hope Sisters. There's something that I heard today too on the news. Diane Berendt, she has a Facebook page for Survivor Core. SURVIVER Core, CORE. And I think that's wonderful. It's another support group there. She actually encourages a lot of women who are diagnosed, or men with the coronavirus, eventually to donate their own plasma, which is something that they're doing now to help other coronavirus patients. And then also we have a yoga, Tamara. She has a wellnesstherapyyoga.com. She actually is going to be starting some live yoga sessions through Zoom, and you can find her at wellnesstherapyyoga.com.
Okay.
Can I shamelessly plug Cindy's book?
There it is.
This is important because for breast cancer active patients, survivors, and their families, this is an amazing book written at I'll say a layperson level, although there is a lot of very robust information here. So I know with my chapter on the upper limb, I know I didn't try to so Cindy, the next edition needs to have something about virology and epidemiology in terms of community health, because yes, people who are potentially immunocompromised, like many other illnesses, but at least for breast cancer, they need to be informed about basic principles. So
Yes,
I
thank
love
you
it.
so much.
Thank you. Thank
And
you
also,
very
one
much.
proud of it.
just one other thing, the book is a compilation of doctors in our community, including my boss, okay, Dr. Roger Corey and Dr. Daniel Calva Cicada. There's reconstruction, there's chemotherapy, there's yoga therapy, mindfulness and meditation. The book is 400 pages, right? Dr.
Yeah,
Badia,
nutrition.
400 pages. So, and it is on Amazon. It is a very good book, even though I helped put it together and my story navigates. We have beautiful people who read it and did testimonials, such as Mariel Hemingway, who is my idol. I think she's a fantastic person. But the book is great. And thank you, Dr. Badia. Thank you.
Yes, thank you. I'd like to thank you both very much. Dr. Badia, amazing information. Thank you very much. Again, that website that you've been mentioning, doraldoc.com. Cindy, I can't thank you enough. You always have amazing information. You've got 3 wonderful books. Thank you, guys. We'll do this again. As this goes on, I would love to do this again with both of you. So thank you. You can find this on my YouTube channel. You can find me on social media at Erica Del Sordo or Erica Del Sordo Productions. Twitter, I'm still at Lauren Lane 7 and ericadelsordo.com. Thank you guys very much. Have a wonderful day and stay
Thank you
healthy.
so much. Thank you.
Thank you. Bye-bye. Be
Bye-bye.
safe.
You too.